A young woman in her late 20s once walked into our clinic carrying a thick folder of medical reports. She had been diagnosed with Polycystic Ovarian Disease, or PCOD, several years earlier. Over time, her symptoms had slowly accumulated. Irregular menstrual cycles, weight gain despite dieting, persistent acne, mood fluctuations, and excessive hair growth. She had consulted several doctors and tried multiple treatments, yet each treatment seemed to address only one part of the problem. Finally, she asked a simple but important question: why is my body behaving like this? Her question reflects the experience of millions of women around the world. Today, PCOD has become one of the most common endocrine disorders affecting women of reproductive age, yet its true nature is often misunderstood. PCOD is commonly described as a hormonal imbalance. Doctors often explain it in terms of increased androgen levels and ovarian cyst formation. But this explanation captures only part of the picture. At a deeper level, PCOD is strongly connected to metabolism, particularly the regulation of insulin. Insulin is widely known for controlling blood sugar, but insulin also interacts with ovarian cells. When insulin levels remain elevated for long periods, the ovaries may begin producing excess androgens. This hormonal shift can disrupt ovulation and lead to irregular menstrual cycles. This is why PCOD should not be viewed only as a reproductive disorder. It is fundamentally a metabolic hormonal systems condition. The rise of PCOD is closely linked to modern lifestyle patterns. Late night schedules, chronic stress, sedentary routines, and highly processed diets disturb the body's natural metabolic rhythms. Women's physiology is especially sensitive to these disturbances. Reproductive hormones operate in delicate cyclical patterns. When metabolic and neural signals become unstable, hormonal regulation begins to falter. Traditional Ayurvedic physiology offers another lens to understand this condition. Within this framework, PCOD can be interpreted through the interaction of three physiological forces: Vata, Pitta, and Kapha. A Kapha-dominant metabolic state may lead to weight gain, insulin resistance, and sluggish metabolism. A Pitta component may contribute to inflammatory changes and hormonal imbalance. Meanwhile, Vata imbalance may influence irregular cycles, anxiety, and unstable rhythms in the body. These forces interact dynamically, which means PCOD cannot be understood as a single static disorder. Within the PRISM framework, Polyscientific, Regenerative, Integrative systems medicine, PCOD is viewed as a systems-level imbalance. It involves metabolism, hormonal signaling, neuroendocrine regulation, inflammatory pathways, and cellular electrical activity. Cells communicate through tiny electrical gradients known as membrane potentials. When metabolic signals change, these electrical states can also shift. This can alter how tissues respond to hormones, stress, and environmental influences. One important insight from systems research is that no two individuals experience PCOD in the same way. Some women show stronger metabolic symptoms. Others experience hormonal or emotional changes. This variability highlights the need for personalized metabolic assessment. Because understanding the body's overall physiological state is often more important than focusing on a single symptom. Ultimately, PCOD is not simply a hormonal disorder. It reflects a deeper imbalance in metabolism, neuroregulation, and endocrine signaling. And when systemic balance is restored, hormonal harmony often follows. Understanding this principle may help reshape the future of women's health. Thank you.